This is also Pediatric Health Night here in Emily, a very special night as Florida Hospital has a partnership with Johns Hopkins All Children's Hospital, and every child arriving here this evening is receiving one of those wonderful Lightning bears from Florida Hospital. And also, fans arriving here can deliver a buddy bear with an attached note of encouragement from both fans, and the kids at the hospital will receive those bears. Florida Hospital, with an exclusive affiliation with Johns Hopkins, elevating child care in Hillsborough and Pasco counties. And we talked to Dr. Michael Longley from Florida Hospital Wesley Chapel, and we asked him what situations right now he's seeing most often from children visiting emergency rooms.
You know, right now, we're actually seeing a lot of high fevers. We actually got an unusually late start on the flu season this year, and the typical headache, cough, sore throat, don't want to do anything, don't want to eat, don't want to drink. And we're seeing flu well into March this year, which is a little bit unusual for us.
Going to the emergency room can be unnerving, scary for all of us as adults. How do you make it more friendly and welcoming for kids?
It is. It's an anxiety-inducing experience, no doubt. And when parents see their kids not feeling well from whatever it is, it's just it's tough for the parents. And we actually have a beautiful facility at Florida Hospital Tampa for the children. It's a 12-bed ER. All the rooms are decorated in pirate theme. We have ambient lighting. The kids can choose what color the lights are. They can show a cartoon on the wall, which is shot from a projector screen. And just as soon as they walk in, they're treated with a level of compassion, because all the folks that are there are really trained in dealing with kids and their parents. So it's a win-win, really.
For parents, it can be a difficult decision. When do I know when to take my child to the emergency room? What is a good rule of thumb?
Well, you know, parents ask me, you know, what do I need to watch out for when I come back? Would you have brought your child here? And it's kind of an unfair question to me, because both my wife and I are docs, so I always say, listen, if you're uncomfortable, or if you're seeing something in your child that's making you just uneasy, then it's always better to err on the side of your gut instinct as a parent and bring them in, let us check them out. Worst case scenario, we met, we said hello, and everything's just fine.
Tell us more about this partnership between Florida Hospital and Johns Hopkins All Children's Hospital.
Well, it's a really exciting partnership. I mean, Johns Hopkins is a world-renowned pediatric hospital, and they have just always scored really top scores on the key measures as defined by the Joint Commission. And we have worked with them in Tampa to come up with protocols, and we've adopted so many of their protocols to kind of guide us clinically. And it just allows us to kind of reach children and their families with that higher level of excellent clinical care. That goes far beyond just Johns Hopkins. Now we're reaching out through all the Florida hospitals in Tampa.
Dr. Michael Longley, thank you.
Pleasure.
Dr. Longley with us.